Welcome everyone to this World AIDS Day celebration on November 30th, 2019. World AIDS Day is actually December 1st, which is tomorrow, but we are recognizing it today, and we're so happy that all of you have come out to celebrate life, to celebrate the lives of those persons living with HIV disease, celebrate the lives of those persons who are affected by HIV disease, and we also remember those who have passed on from HIV disease. We recognize every one of you here who have shown interest and who are here to just be supportive, and we say thank you to all of you. On behalf of all the people that I take care of, I'm saying thank you. We recognize that this has not been an easy journey for anyone living with HIV disease or those who are affected by it, but we are all here, and that means a lot, because those of us that are here can go ahead and encourage others to continue to live. There's no reason why we can't live with this. No one is dying from this disease anymore. I said many years ago that if I didn't have a job taking care of persons with HIV disease, I'd find something else to do, happily. But as that is not the case at this time, I will continue to do the best that I can do to bring encouragement, to bring life, to bring energy for those who are infected with this virus. So again, thank you for being here, and we just hope that you enjoy this day.
Great to see you. This morning at 6:30 or 6 o'clock, we were up and down, in and out, pulling the curtains, looking and trying to feel whether it's going to warm up, whether it was going to dry up, and whether the winds would calm. But we are so grateful. From the outset of the planning, we prayed for good weather, and here is the great weather. Great weather. Thank you so much for coming to be a part of our celebration. This is something we've not done for a very, very long time, and I think it's time now for us to celebrate the work that has been done. Thank you, Kim. Thank you to the Department of Health and your team that's here today. We really appreciate every one of you. But you know what? Our government has been very kind to the situation in Bermuda, and we can say that when we look at other jurisdictions, that we are second to none. Bermuda has done really, really well. And so for those of you that are here, now I want the cameras and the sound to hear you. Give your government a hand clap, and then I want you to give a clap to all the people in Bermuda who have supported the work of STAR. That's it. That's what I like to hear. Well, we have today an opportunity to have you here on the grounds, which is something we don't often do. People come in ones or twos because this is the private residence of our friends affected with HIV. Since opening this place in 1993, May 1st, we've had more than 200 admissions here at Lighthouse. Men, women, and children, and sometimes entire families. These grounds are beautiful and lovely, and they're home to many people. We are grateful that we have this facility in Smith South. The beach is right across the street. Good fishing is right across the street. Bus is right around the corner. And home is home. This is safe haven for everyone who's come to live here. And I'm so grateful that we are blessed to have this property. So now I want to say to you just a few things that are going to take place today. We are going to open our doors so that if any of you would like a tour of the house, then you can. I'd like for you to know and understand the history, or even of this place, not only the Star Charity. And there's going to be a trivia game. So you must listen to every word that's spoken to you by anyone connected with the charity. I want you now to just give yourselves a round of applause for coming out, even though the weather was very inclement this morning. Do that for yourselves. We're now going to ask Reverend Dr. Henry Armstrong if he would come and bless our day for us and thank God for what we've been able to accomplish during the last 33 and a half years. STAR opened 33 and a half years ago, and our first meeting was at Addiction Services in their boardroom.
Good afternoon, distinguished persons, ladies and gentlemen, and young ones at all. Thank you for having me here today. Tomorrow, December 1st, marks World AIDS Day 2019, and I'm proud to be here today to unite against HIV, to show support for people living with HIV, to remember those who have died from an AIDS-related illness, and to thank those organizations who have provided crucial support services for those living with HIV/AIDS and their families. This year's theme, Community Makes the Difference, is an opportunity to recognize the essential role that communities have played and continue to play in the AIDS response at the international, national, and local levels. Communities are lifeblood of an effective AIDS response and an important pillar of our support. In fact, it was Bermuda's community-based organizations working in tandem with the government who took the lead in this regarding during the early 1980s, when AIDS was a relatively new disease and was surrounded by much misinformation and often fear. STAR, Supportive Therapy for AIDS Persons and Their Relatives, was formed in 1986, providing awareness education and sensitivity training for our residents, as well as housing for those living with AIDS diagnosis. Thus, we have the Lighthouse. The Neverland Foundation provided support to the children of those who were HIV positive, support such as clothing, school necessities, and gifts at Christmas and birthdays. Agape House, formed in 1990 as hospice care for persons at the end of life, helping them to die with dignity. At the time, they supported many persons with AIDS. The Ellen Vincent Smith Foundation, formed in 1993, and provided education for members of the public wanting to know more about HIV/AIDS. The only existing organization from that list is STAR, who have continued to provide support to families, community education, housing, the Lighthouse, of course, and food throughout the year to families in need. I suppose it's a good sign that the other helping agencies have fallen away. Such organizations are created when there is a need for a particular service. Once that need is met, services and resources can be dedicated elsewhere. In 2017, Bermuda received a prestigious honor from the World Health Organization as having eliminated mother-to-child transmission of HIV as a public health problem in Bermuda. This would not have been possible without the hard work and the dedication of the following key persons within the Ministry of Health, who I wish to thank now. Dr. Cheryl Peak-Ball, Chief Medical Officer, Ms. Kim Ball, Public Health Nurse, HIV Coordinator, Ms. Gloria Burgess, Coordinator, Maternal Health and Family Planning Program, Ms. Daiwan DeRosa, Assessment Officer, Epidemiology and Surveillance Unit. I'm having a problem with that word. Ms. Susan Jetto, Clinical Laboratory Supervisor, Department of Health, and Ms. Jennifer Wilson, Nurse, Epidemiologist. Thanks to you all. However, AIDS, HIV has not gone away, and the Department of Health continues to provide public education so that younger generations have an increased awareness of this risk and are sensitive to the needs of those living with or affected by HIV. There are currently around 300 persons known to be living with HIV in Bermuda, ranging in age from under 20 to over 65. Over 70% are men, and around 80% of persons living with HIV in Bermuda identify with sexual contact as a risk factor. I cannot stress enough the importance of getting tested for HIV. If you haven't already, do not put it off. Getting tested is the only way of knowing your status for sure. Being diagnosed and starting treatment at an early age ensures that you have a better chance of living a long and healthy life. You can have the test done by your doctor, or you can go to the Communicable Disease Control Clinic at the Hamilton Health Center. Testing at the Communicable Disease Control Clinic is fully confidential and free of charge. Persons at increased risk of HIV should get tested more often, at least annually, depending on their level of risk. Persons who can be at increased risk, including those who have had more than one sexual partner since their last HIV test, persons who have been diagnosed or sought treatment for another sexual transmitted infection, and persons who have sex with a partner with an unknown HIV status. World AIDS Day is a chance to reflect on how far we have come, and it is also an opportunity to focus on raising awareness and understanding of the disease and knowing one's status as we stand in solidarity with those living with HIV. In closing, I would like to acknowledge our Communicable Disease Control Team, public health nurses, and nurse epidemiologists who provide care and health counseling to persons living with HIV/AIDS. I personally value what you do tremendously, and it brings me great pride to be part of your dedicated and accomplished team. Let's continue to work towards an HIV-free Bermuda. Thank you.
There are so many things that we could say about our work during the past 33, 34 years. We began with humble beginnings, but we were on a fast track, and we didn't realize we were on a fast track. But we thank God that today we work at a slower pace, at an even pace. A lot of work has been done, and I can applaud this group of people that have worked with the STAR charity, and that STAR, Supportive Therapy for Persons with AIDS/HIV and their relatives. So many have worked with us. So many have come through our doors for the mission to be accomplished in their lives. We've supported hundreds upon hundreds of families, not only in Bermuda, but the arm of STAR reaches into America, into the Caribbean, and over into the UK. We, every now and then, as I want to say this week, we receive calls from America needing support, needing to be heard and understood. So the mission has not ended, and it's not going to end tomorrow. But Bermuda, know this: HIV infection, HIV, the virus does not discriminate. It's never who you are. It's always, though, what you do or what you have done. I just want to say thank you to everyone that's been here today. We've got a wonderful team. Our executive board is a beautiful team of people to work with, and for that we're grateful. We want to thank the minister yet again. We want to thank the Department of Health again. And on the grounds today, we are going to play some old-fashioned games. We're going to do jump rope, and we're going to do jacks and marbles, volleyball to be set up, and then we have games for the children. Face painting is being set up even as we speak. We have on our menu delicious, funnel-licious cakes. So please, before you leave, be sure to walk over to our food station where we have burgers and Frank's and veggie burgers and turkey burgers, all of those things that you like to eat. And they're done in a very healthy manner, not done in a whole lot of grease or whatever. We remember now, we are a health-conscious charity. So again, thank you so much for coming. We want to just share this with you. The song that's always been our theme is "No man is an island. No man stands alone. Each man's joy is joy to me, and each man's grief is my own. We need one another. So I will defend each man as my brother and each man as my friend." And I speak those words. You heard me say I want us to take it personally. Each man as my brother and each man as my friend. When we began this charity, we called people with HIV persons with HIV. But you know who they are today? They're our friends living with HIV disease. And we're thankful. And we're thankful. So I bid you a good day today. A day full of fun, family, friendship. God bless you, and thank you for coming.